Hello, everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. And today we're going to talk about most commonly asked questions about lupus. So, for those who don't know, lupus is an autoimmune disease where the immune system is overzealous and starts to attack different parts of the body. So, whether it's from the hair follicles to the tippy toes, lupus can cause inflammation and damage to almost every organ and every part of the body. So, today I'm going to answer some questions that my patients have asked over time about lupus. So, my name is Dr. Arinola Dada. I help people with autoimmune disease get their immune system back on track. So, we're going to get right on this. So, one of the first questions is, what are the symptoms of lupus? And so, I always go, when I talk to my patients, I go from the tippy top to their toes. So these are the questions that I typically ask, and these are the symptoms of lupus. One is hair loss. So whether the hair is thinning or it's patchy, those are important questions that I ask patients with lupus. Two, do they get a rash on their face when they get out in the sun? And so they get a rash on their face. Sometimes they're mala rash, kind of a butterfly rash, just the other side of their nose. And sometimes it's just a photosensitive rash. They're out in the sun, they get a rash. It's called a photosensitive rash in a lot of exposed parts of the body. And then I go down. I'm like, well, do you have any sores in your mouth? Patients can have sores in their mouth, but they can also have sores in their nostrils. So sores in the mouth, oral mucosa, nasal mucosa, all count. Next is I go down and I'm like, okay, what about chest? Well, sometimes people have had fluid around their hearts, pericarditis, or fluid around the lungs, pleurisy. And how would you know that? You would have pain either each time your heart takes a beat. And so that would be kind of each time your heart beats, you'll feel the pain because basically your heart is kind of rubbing against the inflammation. Or if you have pleurisy, each time you take a deep breath. Lupus typically does not cause so much issues with the gastrointestinal system, but of course, lupus causes inflammation in all the blood vessels, and all the blood vessels go everywhere. And so people can have lupus that causes inflammation in the blood vessels that supply organs. So other organs, the eyes. So lupus can cause all kinds of conditions in the eyes, whether it is inflammation in the blood vessel to the eye, or whether it's inflammation within the eye. So they can have inflammation on the outer surface, scleritis, they can have uveitis, inflammation in the eye. And you can say, well, how am I going to know I have uveitis? Well, you're going to know because it hurts and you can't see. And then it can even cause inflammation in the back of the eye. So going back to intestinal system, so sometimes you can have lupus because it causes inflammation in the blood vessel that supplies the gut. And so people can end up with gastrointestinal symptoms from that, but that is not so common. Going down the body, the kidneys. Lupus has a high affinity for affecting the kidneys. And in fact, once a person has presented with lupus that has affected the kidneys, we always watch. How do we watch? We get a urine test. We check to see if there's blood. We check to see if there's protein. And there are other markers in the blood that we can check to see if the person has a predisposition to getting lupus of the kidneys. Then as we go down the legs, people can have legs, both the hands and the legs, they can have Raynaud's. And so Raynaud's is a change in color, and the hand can go from white to really red to purple, and it's because the lupus is caused to reduce blood flow to the extremities. And in patients with lupus, not only can the color change, but they can be ulcers at the tips of the fingers and tips of the toes, where there's actually damage to the skin. But I'm going to put a little pause in there. Many people can have Raynaud's, called primary Raynaud's, and they do not have an autoimmune disease associated with it, and they do not have lupus. Okay, we keep going down. Then the legs, you can have inflammation in the blood vessels to the legs, so you can even have ulcers in the legs. People can have lupus affecting their brain. They can have seizures and they can have psychosis. And so, people would typically have had blood tests done. And so when the blood test is done, very commonly there's a positive ANA. Now, a positive ANA does not lupus make, but it's important that for you to have lupus, you have to have autoimmune antibodies that are attacking the body. And this ANA test is an anti-nuclear antibody that your doctor will check if indeed your doctor thinks that you have lupus. So hopefully that helps the questions of what are the symptoms of lupus. The other question is people want to know what causes lupus. Now, we don't really have a good answer to what causes it, but we do know that genetic plays a big role. There are some toxins that have been implicated, and in fact, some herbs, I was reading the other day about alfalfa, can also be a cause for lupus. We know that the sunlight can trigger lupus in people who've already been diagnosed with lupus or who already have lupus, but it's not necessarily the primary cause. Next question is lupus contagious, right? I think people are very caring. They want to make sure that they're not going to infect whether their co-worker, their next door neighbor, or their children. So lupus is not contagious. Next question is, can lupus be cured? Lupus at this time cannot be cured, although lupus can go into remission where there is a maintenance. And we've had patients that have kind of presented, presented in the hospital with lupus, and then years and years later, they haven't really had any symptoms of lupus. The good news about potential cure is that there is so much research going on right now in lupus and autoimmune diseases that this is a very exciting time for people that have lupus because the possibility of really getting closer and closer to cure is happening. Okay, how is lupus diagnosed? Blood tests. Blood test and symptoms. So those symptoms I described above and blood tests. So we have the anti-nuclear antibody. It's not a perfect test, but it's what we've got. We also check for things like serum complements, which are things that when there's active inflammation, it gets consumed. We check the urine test to see if there's any protein in blood. We check the sedimentation rate for inflammation and a CRP. We also do a full blood count because lupus can affect anything in the body. So it can cause anemia, it can cause platelet counts to be low, and it can cause white blood cell counts to be low. So there are a number of factors that we put together, whether it's the symptoms, the blood test, the history, the family history. We put all these things together to try to come up with a diagnosis of lupus. So it's not just one thing. It's not just your symptoms. It's not just your lab test. It's a combination of both that your rheumatologist puts together to make that diagnosis of lupus. And then one question that somebody asked was, can I get pregnant with lupus? The answer is yes, but in close concert with your physician. So, one, if you're going to get pregnant with lupus, your doctor needs to make sure that the medications that we have you on are not those ones that will cause you problems or cause your baby problems. Two, there's some blood tests that people with lupus have called antiphospholipid antibodies or lupus anticoagulant that can increase the risk of miscarriages, and maybe being on some kind of blood thinner may be helpful to prevent that from being the case. So anytime patients are planning to get pregnant when they have lupus, we always make sure that they're working with high risk OB, they're working with their rheumatologist so that we can have the best outcome for that patient and their baby. And then I think the final question I'm going to answer right now is, what lifestyle changes should I make if I have lupus? So we're going to talk about one, protecting your skin from the sun. That's the most obvious one, right? So using SPFs, the higher the SPF, the better the protection for the skin. If you do have a skin lesion, get it checked out. Not all skin lesions are lupus. If you have patchy alopecia, then you can talk to a dermatologist. Sometimes the medications that we can use, we can also do like injections into that area to try to see if we can revive the hair. Next thing is other lifestyle changes. You want to make sure that your organs are okay. So, for instance, if you're prone to high blood pressure, should you minimize your salt intake? Foods, the Mediterranean diet is still the best studied anti-inflammatory diet, right? So you want to make sure that you're not overloading your system with things that are potentially toxic. If you're using supplements, make sure you talk to your physicians because you need to make sure that whatever supplement you're taking does not interfere with the medication that your physician has you on. So I hope this is helpful. This is probably one of multiple videos on lupus, but just wanted to really talk to people about some of the symptoms, most commonly asked questions. My name is Dr. Arinola Dada, and it is an exciting time for people dealing with lupus and autoimmune diseases. is because there's so many clinical trials now. So if you are in the greater Seattle area, find us at Overlake Arthritis and Osteoporosis Center. We can get you in touch with research opportunities that we have or other communities or even Arthritis Foundation because there's so much going on right now. And we want to make sure that people are aware and empowered so they can make the best decisions for them. So follow me and thank you so much. Oh, don't forget, like this video, subscribe, follow us on Healthy Joints, Healthy Lifestyle Show. Everybody take care and have a wonderful day. Bye-bye.